Hello, and welcome to our 2014 Open Enrollment tutorial. To enroll for 2014 benefits, click on the 2014 Enrollment menu option or on the As Easy as 1, 2, 3 graphic. Please note that for your security, this website has an automatic session timeout after 30 minutes, which means if you are not done in 30 minutes, you will automatically be logged off. Please make sure you finish the form or save it periodically so you don't lose your information you've entered. Once the 2014 Election of Healthcare Benefit form loads, select a coverage level election. Remember that the election you choose during open enrollment will remain in force for the entire calendar year. You can only make mid-year election changes if you experience a qualified life event, as detailed in the Special Enrollment Rights section of the Enrollment Guide. To elect coverage for yourself, select Employee Only. This option has a general weekly co-premium of $6, which will be taken out of your check on a pre-tax basis. Please note that many employers require an additional co-premiums, and this amount may be different for you. Check your collective bargaining agreement, also known as your union contract, or speak with your human resource department to verify your weekly pre-tax deduction. Next, check the boxes if you have other insurance covered, such as another employer, or through a spouse or a parent, or if you have Medicare coverage. If you wish to opt out for benefit coverage in 2014, click on the option that states, "I do not choose coverage for myself at this time." Just be warned that you will not have any benefits, including short-term disability, also known as time loss, in 2014. Once you've made your selection, click on the Proceed button to get started. Your name, address, and phone number on file should be listed under the Employee Information section of the form. If any of your census information is incorrect, please make a correction. Remember to answer all of the fields, including gender, marital status, and answering the smoker question. Just as a reminder, the smoker question is for informational purposes only and will not be used to determine and apply terms and conditions of coverage. Click on the Update Changes button before proceeding to the Medicare or other health insurance section. If any fields are incomplete or incorrect, they will be marked in red. Please complete all errors before proceeding. If you are enrolled in Medicare, click on the New Medicare Information button to add your policy information. Enter the enrollee name and Medicare ID as it appears on your card. Next, enter the effective date of each Medicare section that you're enrolled in. Part A is for hospital coverage under Medicare. Part B is for medical preventative coverage under Medicare. Part D is for the prescription drug coverage under Medicare. ESRD is the onset date of the end-stage renal disease. Click on the Update Changes to save the Medicare information you entered. Make sure your name appears under the Medicare Information section before continuing. If you have other health insurance coverage, select the New Healthcare Coverage button to enter the other insurance information. First, start by entering the subscriber information. This is the employee who is the policyholder of the insurance. This could be you if you have coverage through another employer, or your spouse, or parent. Company name is the name of the other insurance carrier, such as Blue Cross, Aetna, HAP, United Healthcare, or Cigna, just to name a few. Company phone is the customer service number listed on the back of the other insurance carrier's ID card. This is used to verify coverage so that the benefits can be coordinated properly between both plans. Policy ID number refers to the ID number that is listed on the other insurance carrier's card and identifies the policyholder. The effective date is important, so please make sure you enter a correct date when coverage with the other insurance carrier started. Next, indicate the type of coverage the other carrier offers, such as medical, dental, vision, or prescription drug. If you're covered under this other healthcare coverage, please check your name and enter the effective date. Note that sometimes the policyholder and dependents may have different effective dates, so it's important to enter the effective date that applies to your coverage in this field. When complete, click on the Update Changes button to continue. Make sure that the other insurance carrier is listed under the Other Health Insurance section before you click on the Proceed button. Next, you must check all 4 boxes in order to certify that 1. You've read the 2014 Open Enrollment Guide, including the Special Enrollment Rights section. 2. You certify that the information on the form is true to the best of your knowledge and beliefs. 3. You certify that you understand that you have the right to elect coverage for yourself and dependents at this time, and that if you fail to do so, you will not have another opportunity until the next open enrollment period. 4. You authorize your employer to deduct the applicable weekly co-premiums on a pre-tax basis out of your paycheck. Once you check all of the boxes, scroll down and click on the Proceed button. This is the last step of the enrollment form. You now have a chance to verify all the information you entered before submitting the form. If any information is incorrect, click on the Change link to the right of the section that you need to correct. Once you've reviewed and corrected all the information, you have the option to print your verification page for your records or click on the Verify button to continue. Finally, click on the Submit form to complete the enrollment process. Congratulations! You have successfully completed the form and a confirmation number for your records has been provided. Make sure you print this page or write down your confirmation number for reference. Click on the Learn More button to find out how you can earn up to $100 off your 2014 deductible. This concludes our enrollment tutorial. For further assistance enrolling, please contact the Fund Office at 1-800-322-8190.